everybody. Welcome to the Spark Spotlight series. Today I have Jeff Bahrenburg. Jeff is here from USI. He currently leads their employee benefits practice in San Francisco. So today we're going to talk about how digital health companies can better partner with brokers. Jeff has a ton of experience in this space. As mentioned, he is currently heading up the USI office for the Bay Area. And has worked with a ton of different employers, mid-sized to large employers over the course of his career across a number of different verticals. He's also spent time at Mercer, Sequoia, Willis Towers Watson, and Buck, so has a great perspective on kind of the broker and consulting side of the industry. And he also volunteers and works as an advisor for startup companies who are looking to really tailor their go-to-market strategies, partnership strategies, and pricing. So welcome, Jeff.
Thank you. Glad to be here.
Great. Wonderful. Well, I will go ahead and just jump in. So to set the stage, would love to kind of hear a little bit about your career working with self-funded and fully funded employers, and maybe what trends you've noticed have kind of been taking place over the course of kind of the years that you've been working within this market.
Yeah. No, I started my career in Southern California as an underwriter. And then moved over into the human capital side and did a number of tours, 16 years at Willis Towers Watson, working on large companies, and then have done a number of leadership roles and individual contributor roles over my career. So worked on the large end and the small end of the market. I think fundamentally the need for a solid benefit strategy and the ability to calibrate your benefits and attract and retain has always been there, but the underlying ecosystem has changed over the 25 years that I've been doing this in terms of the offerings, the networks, the vendors, the solutions. So I've enjoyed seeing the increased complexity that's been created for employers to choose the right benefits for their employees. So obviously the explosion of point solutions, technology, VC-backed, point solution solving for many different conditions over the last decade has been interesting to navigate for employers. So, and the constant cost pressure and balancing those with the need to attract the right talent is a consistent trend that will continue into the future, I see.
Yeah, absolutely. We hear a lot about point solutions because we work frequently with digital health companies that are doing really interesting things, but they may be technically a narrow point solution. So we're working pretty often on how to kind of help them best navigate this environment. So curious from your perspective at USI and just kind of your background as well, when you are, talking to some of these different vendors or who are looking to break into the employee benefit space, what do you normally recommend for how they could partner with like a USI, for instance, on how to kind of reach your employer book of business when they are, technically more of a narrow point solution?
Yeah, it's a real challenge for many of the newer entrants into the point solution, whether they're solving for financial wellness or MSK or GI or the hundreds of point solutions. And as a broker, we get inundated, literally hundreds of vendors are trying to get our time. So I always recommend kind of take a bottoms up and top down approach. So try to get within the consultancies and agencies, try to find out the leaders and the national practice leaders and the subject matter experts, whether it's a population health consultant or an actuary or somebody who leads HR tech, to find out who the decision makers are at the national level. Oftentimes there's, it can be lean or there can be committees that are set up on population health and wellness, and that gets disseminated down to the local offices, but also take a bottoms up approach and try to find out who the local leaders are, the individual consultants that have large books of business and influence, and start there. If you have 5 geographic markets, for example, start with those. It's very difficult. USI has 200 offices around the country, so to reach all 200 is difficult, and many consultancies have a similar footprint. So bottoms up, top down approach. You got to have people on the ground. The CEO and founders need to be involved in those conversations, as opposed to just delegating that to to a sales rep or channel partner. I think those are important.
That's a great call out that the founders and CEOs should be involved in those conversations. We are talking to clients about that pretty frequently because, in the past, sometimes they've asked us to handle those conversations. And we always feel like the best person to represent the company is the company, right? So nobody's going to be more passionate about the company than the founder and CEO. So curious then, just kind of, again, you've got like this broad perspective. What are you seeing trending in terms of employee benefits in 2025? There's obviously been, a lot of work happening in women's health, for instance, which is an area that I follow a lot. There's a lot going on around, more kind of the transparent PBMs. There's just a lot of different trends that are happening in the space. So would love to hear kind of, from your perspective, what you're seeing resonate.
Yeah, I mean, we're seeing an acceleration in that kind of that mind, body, money space in terms of holistic well-being approaches. So your family forming type benefits are still pretty hot. Your financial well-being benefits are an important part of holistic well-being. But I think, I haven't been to a conference or had a conversation where GLP-1s haven't come up. The use of AI in the employee experience is accelerating so fast that brokers and employers are trying to figure out how to leverage that technology. But I think there's going to be continued interest in bringing some of those large market point solutions down to the middle market. So, in the areas of sort of best practices in body, mind, and money. And kind of, because the health plans have done a pretty slow job to kind of keep up, and they've either acquired or bought and patched together those point solutions. So I think keeping it simple for the employer is a trend that I want to see. Like, it's just hard to navigate as a mid-market employer, even as a large employer, the sea of point solutions. People are looking for less, not more, to manage. So the companies that can consolidate those offerings and create that interoperability between the solutions of the health plans is going to be an important trend that I think will drive success.
Absolutely. Yeah. We talk to clients a lot about that as well, with kind of just the buying patterns and the demands from employers for more programs rather than kind of these individual solutions. So that totally resonates with what we're seeing as well. So I think we talked a little bit about how, vendors should ideally work with the USI, but would love to kind of hear your thoughts on kind of like innovation meetings. Those are obviously happening right now. This is kind of the big time of year for that. So how, a vendor should typically, hold an innovation meeting, and maybe like what would be good steps for them after that innovation meeting? Because I hear a lot of times we meet with brokers, we have this big meeting, and then like nothing necessarily happens afterwards. So would love your recommendations on, how they could better navigate that.
Yeah, and each consultancy and brokerage firm is set up a little differently. Some have committees that just do like an innovation committee, and then sometimes it's just one or two individuals within a practice that are more forward thinking and that are bringing those newer solutions to the market. So I think you have to do the kind of table stakes lunch and learn approach. You've got to have an email campaign, you've got to have social media, you've got to find the right executive sponsors at the top level, and then a few ambassadors at the lower level. But innovation and kind of the next gen ideas are going to be clearly part of most strategy and planning meetings. So you just want to make sure that you are educating the consultants and the leaders on what those solutions can bring to the table in terms of next gen solutions and innovation. So lead with education, right? If you're in the financial wellness space, talk about the trends, talk about the competitors, talk about the landscape, talk about the impact, the financial ROI, the impact to the employee experience. And if you educate the consultancies, your solution or your area of expertise will get a seat at the table.
Yeah, which makes sense because, it seems to me from working with the different consultancies over time that, they're oftentimes looking to kind of understand what is happening in the space from an innovation perspective. What are kind of those new trends and insights they can bring to their clients, because that offers value. So if you lead from an education perspective and you have a unique perspective, you're more likely to stand out, I would think.
Exactly. Don't sell, educate is always my recommendation to many of the
that makes perfect sense
vendors that are trying to get my time, my team's time, get in front of USI's leadership, and ultimately get in front of our clients.
Yeah, that makes perfect sense. Let me hit pause for just a second. My dog is Awesome. Well, that makes a lot of sense. Thanks, Jeff. So in terms of, another question that's kind of a hot topic has been consultant and broker fees and compensation. So I think employers are just kind of increasingly looking at just all of the misaligned financial incentives across kind of the industry. So obviously not just brokers, but like their health plans, the PBMs. There's been so much news going on around that. Would love your thoughts on kind of what the best consulting firms are doing to kind of navigate that and maybe be transparent for their clients, and how you guys approach that to really kind of differentiate in the space when this is a concern, obviously, for employers.
Yeah, I think just hitting it head on and letting clients know that you are transparent and disclose any revenue sources, early on in the discussions. Fees usually come up later on in the discussion. At the end of the day, whether it's a fee-based arrangement or a commission-based arrangement or a hybrid, the important thing is the clients know how much they're paying for the brokerage or consulting services that are delivered, right? I think at the end of the day, taking commissions or fees, brokers don't really care how they get compensated as long as the fees are commensurate with the services that they're delivering. But the important thing is that there's a commitment on behalf of the consultancy or broker to disclose those quarterly, annual, monthly sometimes. But commissions are still the predominant way that brokers and consultancies are getting paid. And sometimes that's difficult for the point solution market because the commissions generally come from the medical and the pharmacy plans. That's the lion's share of the revenue. So it's difficult for them to build in compensation, meaningful compensation models into their products because they don't really move the needle. And at the end of the day, there's an inherent bias for brokers and consultants to focus on the plans that have the most commissions or where the revenue is coming from.
Yeah, I mean, it makes sense. That's like everybody, kind of like follow the money is what we say. But I mean, like that's like what, everybody is looking for, right? You have to like kind of feed your family, right? So
in a perfect world, everything is fee-based. You agree on a set amount. There's a scope of services, and everything's net of commissions. But that tends to happen more in the large market. You don't really see that in the middle and the smaller market. And commissions can be a nice way for companies to create budgets and fund their programs that come out of the assets of the plan, as opposed to something that sits outside of the plan expenses. So that is one of the benefits of having commissions. As long as they know it's built into the rates, it gives HR a little bit more flexibility to manage their budget as opposed to being a line item on their balance sheet.
Yeah, that makes sense. So it sounds like it kind of all comes back to like that transparency and setting the appropriate expectations.
Yes, and it's it should be a philosophy of the firm. Some firms are more transparent than others, and a good broker will be disclosing those fees up front and letting clients know how much they're paying annually. And obviously, it's included in the 5500s that are required, but there can be fees that are paid that are outside of that, which can create a lack of transparency.
Is there anything that like a smart employer, say a middle market employer, should be asking, when they're maybe going out to market or looking to work with new kind of brokers and consultancy firms that would maybe help them identify like where those incentives can be better aligned or where there will be that transparency?
Yeah, I mean, generally in most RFPs, there's a question around fees and compensation, and they'll ask it up front. Please disclose all of the sources of revenue because those can exist sometimes in what's called supplemental or override commissions that don't get reported on the 5500. So it's important for a client to ask, are there any supplemental commissions or overrides that exist within your firm, and how are those getting refunded or reverted back to me? It's always interesting to see how they answer that.
Yeah, that makes sense. Thank you. That's super helpful. So, okay. Well, I think we always kind of like to close with some like general questions about the employee benefits space. So, just a few kind of more fun questions. So, what's one thing that you've learned kind of the hard way selling into this market? There's probably a lot, but what would be kind of that top thing?
Yeah, I would say, the best ideas don't always win. It's you may think you have the best solutions and the best mousetrap and be the smartest person in the room, but at the end of the day, in this business, it is still a trust-based people business. The eyeball to eyeball selling is so important. As much as we can do on Zoom and other video platforms, it's so important to try to get in front of a broker or get in front of the buyer or the plan sponsor directly. It is still a relational business, and that sometimes is overlooked by point solutions or newer entrants to the market who think they're selling software or like a tech plan. But in the benefits world, it's still very relational, very trust-based, very people-based. That I don't see changing.
Yeah, you're speaking to the choir on that. We work with a lot of companies that maybe started off in a different space, and maybe they're great, to your point, like technology founders, and they're new to healthcare, or they're new to the employee benefits space, and maybe they've worked in a different area of healthcare, and they just don't quite understand that it is such a relationship-based business. So I think that's super helpful. We're always kind of telling people that as well. So. Another question would be, what do you see as maybe the biggest challenge facing employers, over the coming 12 months?
Handling GLP-1s, clearly, because the trend and exposure and risk on that, and the constant bombardment of the headlines and the news and the changing drugs and the application of those is a big issue, because it is becoming a really big expense for a lot of employers, and if they don't manage it correctly, both from a communication standpoint, because a lot of people are asking for it, is a big one, and just I think managing the number of vendors is out there is becoming more and more challenges. HR teams are leaner and doing more with less, and they want to take advantage of these cool new solutions that are solving for really cool stuff and kind of democratizing a lot of stuff that used to be available to only large clients, and it's coming downstream. So harnessing that with a good broker partner or with a good advisor, a good team, is really important. There's tremendous potential in the AI implications for benefit delivery and improving the employee experience and creating some language models and narrow language models that are going to take a lot of the transactional work out of HR and benefits, because benefits are messy and complex and confusing. And I think the promise of HI to simplify some of that at a transactional level is really important, and will help unlock better outcomes and lower costs for employers.
That makes a lot of sense. So maybe kind of building on that then, of the things that are happening kind of in the employer market, what would you say would be like one digital health solution that you're like most excited about? Would it be kind of the AI piece that you were talking about, or is it something else?
Yeah, I think there's a couple areas, like the using AI to kind of be an aggregator for the many solutions, and being able to create a more holistic kind of navigator type experience for the middle market and small employers. Nobody's really figured that out. Employee communications is such a critical part of employee benefits, but it's like rarely gets the attention and funding.
It's an afterthought, yeah. For
Yeah,
most
and it's like we
companies.
offer these great benefits, but nobody understands them.
Mm-hmm.
I think there's some really cool solutions out there in the financial wellness space, and kind of addressing the financial equity piece of benefits. It's becoming more table stakes. I mean, the sandwich generation, helping people budget, take care of younger, dependents as well as older generation. There's some kind of new solutions in that to really help people be more productive and present at work, as the lines between work and our personal lives are forever being blurred, and providing resources and support to, help with financial planning or estate planning, or sort of the supplemental benefits is a real opportunity to help kind of round out the traditional core medical and dental. I think if some solutions can unlock that and reduce some of the friction in the system, I think that would be an exciting
Yeah,
promise.
that's great, Jeff. I mean, yeah, I feel like there's just a ton of innovation and great ideas that are, happening out there, but it's just like, how do these people like get traction, get to market, all of these things, because there's just a ton of opportunity out there, and we see that every day. We're constantly talking to founders who have a fantastic idea, but they've got to figure out how to kind of like get it out there. So
Yeah, yeah, and
Awesome.
it's not easy, not easy.
No, it's not. It's not. Well, wonderful. Well, Jeff, I appreciate you coming on. Is there anything you'd like to say kind of in closing? Is there, how should people find you? Just anything you'd like to say in closing would be helpful.
Yeah, no, I mean, I'm on pretty active on LinkedIn, and I promote a lot of my activities, both at USI and in the industry, and share a lot of free intellectual capital and like to give away ideas. So follow me on LinkedIn and DM me if you want to be friends.
Awesome. Well, thank you, Jeff. I appreciate it.
Yeah, of course. Happy to be here.